Hi, I'm Dr. Deepti Jain, and I'm an orthopedic spine surgeon. Do you suffer from severe neck pain or severe back pain? Are you afraid that if you go see a spine surgeon, that the first thing they're going to do is tell you that you should have surgery? Well, let me tell you, I see hundreds of patients with back pain and neck pain every single week. And this is a very common conversation I have. So, what are the first steps for treatment, even in patients who have severe pain? Well, in general, for the most part, the first steps are almost always non-operative treatment modalities. And so these consist of various different interventions like therapy, active movement, keeping your muscles strong, stretching your muscles. That is the first step. This also consists of medications. There are lots of different kinds of medications. There are muscle relaxers, anti-inflammatories, nerve pain medications. A lot of these medications can help treat that really severe pain. There are also different kinds of injections that can be performed. These can be injections like trigger point injections or epidural steroid injections. A lot of these different treatment modalities are offered before considering any operative intervention. And the primary reason for that is because most patients will have relief of their pain with those interventions. So we know, looking at studies in general, that we don't even consider offering an operation for a patient unless there's some emergent, urgent problem. We don't consider offering an operation for a patient unless the patient has failed 6 weeks of non-operative treatment strategies. Every single treatment that we do, whether it be physical therapy, whether it be medications, whether it be different injections, and then obviously surgery, everything comes with its own risks. Even things that are considered not that dangerous, like physical therapy. So an adverse event or a side effect or a negative consequence that can come from physical therapy is that, for example, a select few patients will actually experience worsening pain with physical therapy. Medications. Each medication has its own side effects. Commonly, muscle relaxers, patients will experience drowsiness. With anti-inflammatories, very commonly, patients might experience stomach upset. With injections, there are also its own set of risks. So, for example, anytime we do anything inside the body, there's a risk of infection. So introducing a needle into the body can increase that risk of infection. Now, that risk is extremely low, but it's not zero. So the decision to undergo surgery, I always say, is a big one. And it's a bigger one than getting married, because you can take back getting married, but you can't take back what I do to your spine. So making that decision is really determined by no one really other than the patient, because the patient is the one who is living with the problem, and the patient is the one that's going to have to deal with any subsequent consequences. So what I tell patients is, I offer you a surgery when you tell me that your symptoms are so severe that you don't want to go on like this, and you are willing to undergo the risks of surgery to treat those symptoms. And that's when we have a surgical discussion. Another question I get is, what does it mean to fail conservative care? Well, there's no definition around that question, really. There's nothing that means failure per se. It's really a decision amongst the patient. Are my symptoms still continue to be so severe that I want continued treatment, or I want different treatment? And that's, in my opinion, what I consider failure of conservative care.